And Ms. Bryan, tell us about the breadth of efforts by the American Lung Association to address COPD. Start first with prevention.
Well, the American Lung Association has lots of resources to prevent lung disease, and that really is the best way to impact lung disease, is not to get it to begin with. So we have smoking cessation programs beginning with teens called Not on Tobacco that are available all across the state, and then we have Freedom from Smoking, which is sort of our standard in the industry. It's been around since the mid-60s and has one of the highest success rates of any smoking cessation program. It is now available online as well as in a clinic setting. We try to offer a lot of options because one thing doesn't work for everybody. And we've now added to that the Quitter and You component that is sort of a wraparound. We know that most people will attempt to quit 6 to 7 times in process. So we are looking at it more as making a step forward along the way with each attempt. A lot of people feel like they've failed if they don't succeed the first time, but that's not the case at all. Need to keep on trying. And all of that's available on our website at www.lungusa.org. And we also have quitterandyou.org, so you can go straight to it. We do educational programs in the schools and in communities to make children aware before they even think of smoking, what they're doing to their lungs. We all breathe about 25,000 times a day. And if you consider each of those breaths an exposure or you're breathing clean air, you get why secondhand smoke is such an issue. We also have a toll-free call center now at 800 Lung USA, where people can call and talk with a nurse or a respiratory therapist. And we know our data shows about 85% of those calls are for smoking cessation support. We also have Better Breather clubs, and that's for people who are living with a chronic lung disease. And it's designed to help them learn to live with it better. There are a lot of things you can do to improve your quality of life. Things as simple as the time of day that you drive. Don't get in heavy traffic because that additional exposure from exhaust fumes is going to be a problem. What you eat, making it high nutrition so that you don't it becomes a problem to both breathe and chew for a lot of people. So bananas, for example, yield a lot of return food value for little effort. And then things that are as simple as your grooming habits, how you dress, that can make living with the lung disease simpler. We also conduct research, and this year are really focusing on COPD and the genetic components that are related to it. Dr. Pleasance mentioned that smoking is about 90% of all COPD. There are also some occupational exposures and environmental exposures that contribute, but there is a smaller category, about 8 to 10% have a deficiency called alpha-1 antitrypsin deficiency. It is hereditary, and that is a lack of surfactant on the surface of the lungs, which is sort of a fluid lining that allows the exchange of oxygen. So all of these things work together to help people live with lung disease and to continue the research so that we know what to do for them more effectively.